Wow, thank you so much. I cannot let Hannah down. So, to start off, I'll tell you a story. Several years ago, my brother-in-law, who is Norwegian, decided to have a destination wedding in Miami Beach in July. It was 100 degrees in the shade. We were moving from air-conditioned room to air-conditioned room to air-conditioned room. Finally, we got to the car. And now I'm driving next to my 75-year-old mother-in-law, who is Norwegian, and she is wilting in front of my eyes. And as we get on the freeway, she barely lifts her head enough to look out the window and notice a pattern among the billboards that are whizzing by. They all look like this. Only 4-minute wait in our emergency department. And the next one, 3 minutes and we'll take care of you. Come on in, we've got a great cardiology department. We have the only sunburn room in South Florida. That's a real one. And as we're going, I'm starting to talk to my mother-in-law, and I say, you know, these billboards really reflect the incredible customer service of the United States healthcare system. But as they pass by one after another, they start to blur together, and they start to look like this. Hotel billboard. And my mother-in-law looks at me, and she cocks her head, and she says, Josh, how do you tell the difference in this country between a hospital and a hotel? Now, before you make fun of my dear mother-in-law, who is Norwegian, we're going to have a little quiz. I'm going to read you a slogan, and I want you to shout out whether it's a hospital slogan or a hotel slogan. Okay, I'm counting on major participation here. You ready? First thing that comes to your mind. You'll love the way we care for you. Something to feel good about. Our best every day. First, best, always. For the journey that is life. Not so easy, is it? Okay, here we go. Couple more. We love having you here. Taking care of you today into the next century. Okay, let's see. None of them are hospice. Just in case you're wondering. Okay, here's the answer. The first 5 are all hospitals. The bottom 2 are hotels. We love having you here is the Hampton Inn, and taking care of you today into the next century is the motto of Sheridan. So how many people got them all right? Not a single person is raising their hand. Why do so many hospitals resemble hotels? Maybe it has to do with the fact that we pay hospitals like hotels based on the number of people who are staying there. And it's worth asking the question, is this incentive good for the country? Because after all, hospitals and hotels are not the same. They may both have room service, but in the hotel, you're much more likely to be able to check out in the morning. Okay, that's a bad, inappropriate metaphor, because actually last year in 2015, U.S. life expectancy dropped for the first time in decades. We're ranked 31 in the world. Of course, when it comes to cost, we're number 1. That line at the top, that's the United States cost, and every other country is underneath. We pay far more than any other country for healthcare, even though we're 31st in the world for life expectancy. Higher costs, shorter lives. Does it make you wonder, maybe we shouldn't just pay hospitals after someone gets sick? Does it make you wonder, maybe we should encourage hospitals to invest in the health of their communities? What if we stopped paying hospitals like hotels? So that was the question that I had when I got back to Maryland. I was the Secretary of Maryland's Health Department working for Governor Martin O'Malley, and we had a hospital funding crisis on our hands. The typical way to deal with that kind of crisis is to find a way to get more money to pay hospitals whenever they take care of a patient. But we had the opportunity to do something very different, to go from paying hospitals a fee for every service to giving every one of our 46 hospitals a global budget, which raises a very important question. What is a global budget? I learned the answer to that in Western Maryland. This is Western Maryland Regional Medical Center in beautiful Cumberland. It is one of the first hospitals that went onto a global budget. It is a big, beautiful new hospital. I walked right into the lobby and noticed it was almost deserted. Where were the patients? In fact, the day I visited, it was only 55% full. And over in the corner of my eye, I see someone walking across this huge lobby with a spring in his step and a smile on his face, and it's the CEO, Barry Ronan. And I think to myself, if I were the CEO of a half-empty hospital, I would be at my desk brushing up my LinkedIn profile, thinking about my next job. But this guy was smiling. Why? He explained to me that under a global budget, he knows his annual revenue in advance across all payers, public and private, Medicare, Medicaid, Blue Cross, Kaiser, and all the rest. It doesn't matter how many people come to the emergency department. It doesn't matter how many people come in the hospital. It doesn't matter the number of CT scans or MRIs. And without the need to keep the beds filled, he can actually invest in prevention. Indeed, he showed me a clinic in his hospital that he'd set up to take care of anyone in the county with asthma, diabetes, and heart failure, with nurses, social workers, dietitians, all free of charge. And that clinic was so successful, it dropped the number of people who needed hospitalizations to the point where they closed wards of the hospital for lack of business. And he pulled me aside, that CEO, and he said, you know, we kind of have an unofficial motto for our patients here now. We hope to never see you again. Now, that probably wouldn't work out very well for a Sheridan. This is Carroll Hospital Center in Westminster. The CEO there, Leslie Simmons, did an interview with one of our faculty members at the Johns Hopkins Bloomberg School of Public Health. And she said that when she went on a global budget, it transformed her understanding of what hospitals could do to keep patients healthy. She expanded the number of hours that social workers spend with patients in the emergency department to address the social reasons that they were sick. She decided that instead of just giving prescriptions to patients who were leaving, she should give actual medicine so they were sure to be able to take it. Instead of giving the phone number of a doctor to call, she made sure everybody left with an appointment and a date and a place and where to go. This is Meredith Hospital Center in Hagerstown. And this hospital came to my rescue when I was the state health secretary, because we had a dispute between the school system and the health department, and the school health program was completely up in the air in this county. And then I got a phone call from the CEO of Meredith, Joe Ross, and he said, Josh, we're going to hire all the school nurses here at the hospital. And I said, why would you do that? And he said, Josh, we're on a global budget. We looked at our data. We have so many kids coming in for asthma attacks to our hospital, and they're all preventable. We can run that school health program at a break even. We can concentrate on asthma, and we can save and make money on the back end by preventing all those hospital visits. And that's exactly what they did. Huge declines in emergency department visits and hospital admissions across Washington County for asthma. And it made me wonder, what's stranger? A global budget for a hospital, or the fact that in every other state, hospitals are paid more the more kids that are struggling to breathe? Now, I realize what's going on in Maryland is a bit of an experiment, and I'm deeply grateful of the support we had from the Center for Medicaid and Medicare Services, the Hospital Association, and everything that they did to make this work. Johns Hopkins played a really important role at the beginning and all the way through to the present in this. And we knew, because it was a bit of an experiment, that we had to be careful. We put in a number of different kinds of safeguards, including assurances that the quality of care would improve even as we were controlling costs with global budgets. And then we started getting results. In the first year, we found that we saved Medicare $116 million in hospital costs alone, and the quality of care improved. And then, just in January, we got results for the first couple of years. They showed that hospitals in Maryland are growing much more slowly than the state's economy. And we've saved already $319 million in Medicare compared to the overall cost trends in the country. Even more impressive, we've had a 48% reduction in potentially preventable complications among patients in the hospital, and we've had a massive decline in readmissions, which is something that we were very much looking forward to. Now, this is still just the beginning in Maryland, and there's a lot more to do. And while I'm deeply grateful for all of the people who have made this work, and it certainly just wasn't the health department, it was many people at Hopkins, the other hospitals, and all across the system who made it work. And while it's nice to get some credit, which we do from time to time, for thinking a little bit differently, what's really important is not just the work that we've done, but the idea. The idea that hospitals don't just have to wait for people to become sick. That hospitals don't just have to think about growing the business or the next wing of the hospital or who it's going to be named after. That hospitals can actually be part of the solution for health in their communities, that hospitals don't have to act like hotels. Well, we started with Maryland, but in January, Pennsylvania said within 3 years they'd take 30 hospitals and put them to global budgets. Or as I like to say, today Maryland, tomorrow Pennsylvania, and after that, well, I don't know what's going to make my mother-in-law impressed, but we can always hope. Thank you very much.